Please welcome Chief Medical Officer of Qualcomm Life, Dr. James Malt, Chief Medical Officer at Samsung, Dr. David Rue, Chief Medical Information Officer at AMA, Dr. Michael Hodgkins, and moderating our discussion, Global Health Technology and Policy Reporter from Forbes magazine, Nicole Fisher.
I hope we get to keep these. Thank you.
I'm going to walk away with it.
You can. Thank you, everyone. We are so excited to be here. And I just want to say that we're the first general session of the first health. No one else can ever say that.
There we go.
No pressure.
Yay.
We're literally going to frame everything.
Better be good.
You better be good.
Right.
So I'm really excited to be here, primarily because all of these men, while doctors, do so many other things, and that's what we're really here to talk about. And so they sit at the intersection of so many aspects that touch healthcare and technology. And so I do believe you really are going to frame all the things that are going to be talked about here. And so I want to get us, we have a short amount of time, so I want to jump right in, because we also have a big announcement to make. Oh, no.
You're losing your pillow already.
I know. Sorry. All right, everyone in the future, know that the pillow moves. So I want to get going. And so, the world is changing, and it's changing very quickly. And everything from, we're going to talk about apps, wearables, mobile, all kinds of things. But the key word from all of our conversations that's come out is connectivity. So I really want to talk about connectivity, and then about what you guys are going to do to solve a whole lot of problems and build a whole lot of trust within our systems. And so, Jim, I'd like to start with you. And so you are chairman of the Health and Fitness Technology Division of CTA, the Consumer Technology Association. You host the big CES summit here in Vegas every year. So talk to us a little bit about why this was so important to you, and to frame the conversations happening at health is something you wanted to do.
Well, thanks, Nicole. Obviously, we're all here because healthcare is finally advancing into the digital age. We've been waiting for that for probably about 2 decades now, and has been, for many reasons, far behind other sectors of our life and economy. So, the good news is this is probably the tipping point, and the good work that has been done by a lot of organizations, both on the technology side and on the medical professional side, is coming to fruition. The Consumer Technology Association in particular, which, as many of you may have heard of the Consumer Electronics Show here in Vegas, has, in the past 4 years, created a dedicated division board which starts to represent the enormous stakeholders of the 2,000 member companies that are interested in healthcare, and Dave, to my right, is one of the prime examples of that participation. It's really all about how do we advance the state of digital health right now as it relates to these devices and mobile apps that are able to collect a lot of data about ourselves, and now being able to share that with the people taking care of us. And as we've seen over the past few weeks, there's a few issues Mr. Zuckerberg can attest to as it relates to privacy and security. But in healthcare, there are even more issues. And if doctors, in fact, this year are starting to get paid to take care of you without actually seeing you in person. So you can now send your blood pressure measurements to your doctor electronically, and your doctor can get paid to review those and actually manage you in a virtual world. There's going to be potential issues related to that, and I think that's the conversation that we're hoping to bring forward, and at the same time talk about what we think is an exciting development in at least being proactive in addressing these issues?
Sure. I mean, privacy and security and potential liability. I mean, there's a lot out there. So, Dave, I want to jump to you. So, as a physician, but at Samsung, how are you thinking about this space?
Well, I think over the years we've learned that there's tremendous opportunity with the mobile applications and mobile health. A large part of it has been focused on engagement, really helping get individuals to be using applications, trying to figure out ways that this can help improve their lives. We've been spending a lot of time thinking about how these data can then be sent to clinical teams. Where we really haven't spent as much time, and really what the focus will be for this discussion, is talking about the security, the accuracy, the safety behind that. Because as we start building these applications and these platforms, there's a tremendous opportunity to do good, but potentially if we don't think about putting some guardrails in, we might potentially run into issues. And that's what we're trying to talk about here. How can we start being more proactive in our thinking, understanding a bit more about what those potential risks are. As a clinician, I would love to know a little bit more about where these numbers come from. If I got a number that said blood pressure was 200 over 120, well, that would be alarming to me, but I would like to know where did they get that from. If it came directly from a medical device, was it something that they did at home? Was it an automated mechanism? So, just trying to enable a little bit more transparency around that process will give us a greater ability to take care of patients.
I mean, and the accuracy, right? There could be a huge bandwidth there.
Yeah, absolutely. I mean, we may find that certain devices, just based on their inherent nature, you'll have different levels of accuracy. And that might be fine in certain use cases. But when you start talking a bit more about some of the medical monitoring, then you're going to have to start thinking about how can we use the tools most efficiently.
Yeah. So you guys are both, big multinational companies. And so I want to come over to you. Because we also have to be thinking about the governing bodies and the agencies, and as physicians, the American Medical Association has a lot to say about these things, and increasingly will. And so I'd like to come to you, Michael, about your involvement and why you're here with these guys.
Well, thank you very much. And I'm wearing two hats tonight as Chief Medical Information Officer for the American Medical Association, the largest physician association in the United States, but also as the chair and president of Exertia, which came together a year ago, February, and published our first guidelines just this past December.
Yep.
And Exertia is part of what at the AMA we refer to as our innovation ecosystem, which is a number of initiatives that really were meant to address what our CEO referred to a few years ago as digital snake oil, which got a lot of attention, some good, some bad. But what he was pointing to was really in the EHR space, the trouble that physicians were having with those tools, and foreshadowing what's happening in the home medical device and app space, where we're now over 300,000 health-related apps, adding 200 a day by most accounts. And Exertia was started specifically to develop a set of guidelines or just guidance for the industry around 4 basic questions that physicians have, that consumers have, I think, the same questions about. In no particular order, does it work? What's the evidence? Yep. We don't want to wait around for the Federal Trade Commission to have to come in and pull apps out of the App Store for misrepresenting their ability to measure blood pressure or diagnose skin cancer. That just isn't scalable. That's not going to work. So does it work is something of importance to physicians who are very evidence-based, evidence-driven, but I think we should all respect the fact that consumers want to know it works too before they actually resort to using this for their care management, especially when they have serious chronic diseases. The next question was, do you get paid? How do you get paid? Physicians are interested in that. The corollary that patients and consumers have is, will my insurance cover this? Or is this going to be out of pocket? Third question was, what are the liabilities? So physicians are concerned certainly about medical malpractice, but they're also concerned about privacy security issues, how they comply with the HIPAA legislation, and so forth. But consumers want to know what their rights are. And that isn't always clear, that they have an absolute right to their health data to use as they see fit. And then the last question that we're trying to address is, will it actually work in practice? From the physician standpoint, is it going to further disrupt the workflow and the care team's efforts, or is it going to actually create efficiencies, which we haven't seen yet in the electronic health record space? Is it going to disrupt my relationship with the patient? You know, it's seeing the patient at a distance or interacting with them virtually is fine, but I want to preserve the importance of that relationship that I have with the patient. And by most surveys, patients want that relationship too. So those are the questions that our guidelines were meant to address. And one of the important things that is coming out of this effort that was just announced earlier today is that Exertia and CTA have entered into a collaborative relationship so that we can really build on the strengths of both organizations to really address the need, the urgent need, for better guidance and better standards in the device and app space.
Yeah, this is fantastic. Yeah, this kind of deserves a round of applause, you guys. Like, we are now trying to set standards. And Jim, the way you've described this, and I love it, you said, think of it as like food labels for apps. And it clicked with me, and I was like, I get it. Because, you know, there was a whole lot of words involved, and I was like, I don't know that I fully understand. But so I actually want to come back to you right away. You know, Michael, so how, from the patient perspective, do you think a set of guidelines or rules or a food label, like what is it that you're really, from the patient angle, trying to do with this collaboration?
We're really trying to help consumers. I like to just think of them as consumers. They're not always patients. They're patients when they're sick and they come to see me or I interact with them virtually, but they have real lives. And their lives and the things that they get and have to deal with outside the clinic are just as important as the workflow inside the clinic. So we have to tailor these things to patients, and we have to make it possible for them to make the best choices for their health care. And without this kind of guidance and without the collaboration, I think, between our two organizations, you know, where do they go for that guidance? I mean, they may Google it, they may ask a friend, but can they really rely on that to make important decisions about their health?
It really is twofold. It's the consumer, and you want to understand all these questions about, is this actually doing what it's supposed to be doing? Having that third body to be able to sort of validate, to say, yes, this actually has been proven in clinical trials to work the way it's described. But also on the physician side, and as clinicians, you know, taking care of patients, using these technologies, we want to know what can we rely on, and we want to be able to leverage those, and then in certain cases build off of that. There's so many apps out there. There's so many great platforms. Sometimes sifting through that, and clinicians don't have the time to do that. They would love to be able to have a mechanism that allows us to be able to understand what are the pros and the cons and what are the advantages. So being able to put some guidelines and standards around that will help both the consumer and the clinician.
Fair enough. Go ahead.
Well, Nicole, if I may, we're all consumers in here. Let's make this real. Raise your hand. There's 300,000 mobile health apps or so. I'm guessing we can use the audience here as a survey tool. Raise your hand if you or someone you know has one or more mobile health apps on your smartphone today. All right, keep it up in the air. Keep it up in the air. Keep it up in the air if you know exactly what is being done with the data from those apps that you've signed up for. Well, there's one guy out there. Which app is that? Geez, I mean, that's the thing. I mean, think about yourself as a consumer. We have no idea what's happening to our personal health data, and we're healthcare executives and clinicians. And the point being is, this is going to blow up in our face sooner or later if we as an industry and as clinicians don't step up and are proactive about basically doing the right thing. It's about transparency. What is a patient or a consumer going to be signing up for when they download an app? Is it secure? Is it private? Is it being conducted under rules of HIPAA or not? You know, where is it being hosted? Is the data being sold, and is my PHI being used for analytics? Those are the kind of things that we're starting to want to know just as consumers. And then as doctors, you know, if this data is coming to me and I'm going to be making life and death decisions, like Dave said, where is it coming from, and is it accurate, and And can I rely on that, or do I need to bring the patient in? These are all very reasonable things. The CTA is an organization that has a long history of generating very significant standards that you and I all take for granted, like HDMI cables that connect all of our television sets and so forth. So it's very exciting that you've got a coalition of technology companies from large to small coming together in a public-private professional arrangement to figure out what are we going to do here. And this is an invitation to all of you in the audience to join in. The bigger the coalition, the better. We have the participation of some very prominent government agencies, and including the FDA has been very supportive and on board with this type of
And
let's
ONC
talk.
as well.
And ONC.
And ONC.
So, and so you have on the one hand the preeminent organization that has represented certainly the mobile device space writ large, not just in healthcare, but certainly in healthcare as well. And you have Exertia, which was founded by the American Heart Association, American Medical Association, HIMSS, all very prominent associations, all of whom have a shared mission to improve the landscape of care. And in the digital space, we're opening up a whole new vista of opportunity to collect information that is maybe even more relevant to taking care of patients than what we tend to focus on clinically.
Sure. So I want to pursue that a little more as we're talking about, I live in DC and happen to be a health policy advisor. And so as we look to these agencies, what exactly is their involvement? Is it yet to be determined? What kind of timelines are we looking at, inclusion? And we all share friends within organizations like the FDA. How are you approaching them, talking with them, including them? I'm certain with CTA in particular, right? They're very integrated conversations. So where does that stand?
So we have regular interaction with a variety of government agencies, ONC, FTC, FCC, and the FDA, lots of alphabet soup. The important thing in all of this activity is basically a set of voices. It's not one individual company, but you're coming in with a unified kind of voice amongst a large cadre of organizations that are speaking to the same tune. And that's kind of the dream come true for most of these government agencies, because it's frankly, it's cover, it's political cover, because this isn't the voice of one company, but it's the voice of an entire industry that's speaking out, and it's hard to say no, as long as it's probably, doing the right thing for the common good.
I would also say that in addition, in our discussions with, and I say the CTA in general, with these governing bodies, one thing we've learned is that it's not just about putting regulations to slow innovation, and it's about understanding how can we accelerate innovation, but at the same time put in some safeguards that allow consumers and individuals to be able to use this most effectively. So there is absolutely a big push to accelerate that. And if you think about some of the recent initiatives around the pre-cert program, where they've taken 9 companies to accelerate the pace, Samsung being one of it. We know that this is not just about regulations. It's about how do you balance that. Make sure that you're going through this in a way that's efficient, but also provides great value to the end user, consumers, clinicians.
So you don't know this, but my dissertation is on public-private partnerships, and you basically just recited my opening paragraph of the importance of merging policy and science. I love this.
Well, when Exertia has both the FDA and ONC represented on its board as liaisons, but look, these entities don't have the bandwidth to deal with the challenges that we're presented with in this emerging digital space. And, but I asked this audience the question, do you want to wait for regulation or do you want to self-regulate? Do you want to come together and do the right thing so that the government doesn't have to bring in their heavy-handed approach that will likely stifle innovation? And right now, though, we're not doing a good enough job. And the reason that CTA and Exertia are coming together in this collaboration is because we want to move in the right direction to create a discipline that avoids this sort of Wild West mentality that any app, any device, is equal in the eyes of a consumer or a physician.
Well, it's time. If we are going to advance the state of digital health, these are prerequisites. It's going to be imperative to develop this trust relationship between the consumer, patient, and the provider community. And if that blows up on either side, all of our dreams are going to get set back once again. It's important. We're not going to any government agency and asking for money. We're not asking the taxpayer to pay for anything. In fact, again, as an industry, we are going to be proactive and do the things that are necessary and appropriate to have transparency and disclosure and make it possible for people to take better care of us virtually. There's another coalition that was also announced just in the last few days. It's called OpenMed Ready. It's on a technology level, working between Qualcomm and Philips and ARM and a set of other organizations, working on at the firmware layer, how do we make it possible to do consent and identity management and be able to use the great technology built into our phones that know who we are based on our fingerprint and our voice and our retinas, and be able to say, okay, I'm sending this data over here to Dr. Rue, and it's coming from me. And these are very, very important things that if we can unify as an industry, and again, this is very invitational. We welcome everybody who's interested to contact CTA, to contact Exertia, to contact OpenMed Ready. Let's get this together, and frankly, we will together save hundreds of billions of dollars and save millions of lives once we're able to get into this digital trust relationship in healthcare.
So how do you, I want to go with that, and I love what you're talking about. What really comes out is the intentional nature, like the intentionality of this. But how do you intend to make an informed consumer? Because I would argue there are lots of people who don't know what's on a food label. And so whether it's a physician or a patient, right, if you're going for clarity and trust, how are you going to help educate the consumer, no matter who that is?
Dave,
You're the consumer guy.
I mean, I'll tell you, ongoing efforts to educate, obviously that will have to continue throughout, but I think that when you are looking at where healthcare is, or where digital health is today, a lot of it is around apps, people taking care of themselves. When you get to the point where it is now tying into the care of your condition, you have now looped in your clinical team, your hospital, your physician, your care team. In that scenario, it's not just about educating one individual, it's about a team approach towards managing one's condition. And when you look at it from that perspective, you want to adopt technologies that are now proven, that have some greater transparency. And so it's not about one individual learning it, it's about, as a healthcare delivery system, we are now starting to recognize that virtual tools can be very effective. In fact, that's probably one of the reasons why the timing of this is so important, because we're now starting to move towards virtual care, where many individuals will be managed outside of the hospital, outside of the clinic. And it's not just telemedicine, it's about use of everything from remote patient monitoring to helping us understand one's daily life and lifestyle. And as we start getting into that mindset where we want to be able to use that information more effectively for care, it will be a team approach. And I think that with that team approach, you'll have many individuals that will really weigh in on this. And that will allow us to be able to provide a greater level of understanding and really figure out how we can most effectively use this.
That's so important too, David. We in the profession, in the medical profession, we all often talk about patient-centered care. The only way to achieve patient-centered care, I think, is through these virtual capabilities. And the only way to manage chronic disease is outside of the brick and mortar of the clinic.
True.
You have to be out where the patient lives, works, socializes, and so forth, because so much depends on the patient's interaction with whatever the treatment plan is, whether that's taking their medication or following a diet or whatever. And just bringing them in the clinic for 15 minutes to try to sort that out isn't the answer. No. So we're never going to succeed in the chronic disease era without these tools. They're so important.
Well, again, let's make it vivid. When, as Nicole mentioned, we go to the grocery store now routinely and pull something off the shelf. We can see what's in the food that we're potentially buying. Right now, you go to a retail store and buy a blood pressure meter or even a pulse oximeter. It turns out, you may not know this, some pulse oximeters don't even go through an FDA clearance because they're used for fitness and exercise, but have no medical claim. So consumers right now often can't even tell the difference if their doctor tells them to go buy a pulse oximeter because their uncle has COPD, whether they're buying a medical device or they're buying, frankly, a toy. And the FDA has the accuracy and other requirements on the labeling inside the package. But I think there's a lot that can be accomplished as part of this effort together to come to ways of making it easy for consumers to understand what they're buying in the store, maybe something on the packaging, stay tuned, and maybe when you download a mobile health app, there's a consistent way in which we as consumers will be able to see what are we signing up for, and that, it won't be that hard. We just have to come together and agree on what those things need to be and what they look like. Again, I'm making the pitch. This is invitational, yep. And the more we come together, the faster then we can pull this off.
And just to use a concrete example, hypertension. Hypertension is the leading cause of death and disability globally as a result of heart attacks, congestive heart failure, stroke, and other problems. And yet, we only manage hypertension in the clinic about 50% of the time. Now think about that. The #1 cause of death and disability globally, and we're only successful in managing it in the clinic about 50% of the time. The good news is that there's mounting evidence that giving people blood pressure cuffs and letting them monitor their own blood pressure, and even some evidence to suggest that they can titrate their own medication when given proper boundaries to work within, can probably more successfully manage their blood pressure than I can do it in the clinic. So that's just to illustrate how important this is.
That's fantastic. And I like that you said there may be labels on packaging. It was very subtle. So now that the big announcement was made just hours ago, what kind of timeline, what can people in the next few days versus when they go home, if they want to get involved, what's the timeline? How do people start contacting you? What's the short-term and long-term vision?
Well, there's contact information on the press release, certainly, but I'm here representing Exertia, Jim's here representing CTA. Come see us. Talk to us about how you can get involved during the conference. Send us your contact information. We'll reach out to you if we receive it, and we'll go from there. Exertia is in the process of gearing up a number of work groups to start to refine the development of the guidelines that we've done. We're going to be doing that in collaboration with CTA and their standards development groups. So we're getting ready to move ahead with this.
And both of Exertia and CTA have had these initiatives in motion for upwards of a year now. So the committees have been active. We've been in the process of drafting the preliminary set of guidelines, concepts for disclosures and labeling and things like that. It's certainly a work in progress. We're hoping to have things, something figured out by the end of this year. We don't want this to be a death by committee type of effort, but we want to get it right. And again, now's the time to get involved. It's very timely in the minds of a lot of policymakers and things that are being contemplated. GDPR going live in Europe, and so let's get together and figure this out.
Excellent. Well, I want to say thank you to the panelists and thank you to all of you for coming to the first general session. And I look forward, as we teed up this intersection of science and technology and protecting patients and helping physicians do their jobs more efficiently and effectively. So thank you very much, and I can't wait to see what comes of this in 2018 and beyond.
Thanks, everybody.
Thanks.